Well, we had confirmation from the First Minister that the lockdown in Wales will continue for at least another 3 weeks and that schools will remain closed here for most pupils until the half-term, or at least until there's a significant drop in COVID rates. There was a dip recently in the rates in Wales, but Mark Drakeford today said that they were edging back up again. And all of this comes against a backdrop of terrible figures. Another 56 COVID deaths in Wales, and that's among the 1,300, record 1,300 UK-wide figure, which is staggering, really. And the NHS is under huge pressure right now. A record number of COVID patients in critical care in Wales in this second wave. And when you look at this pressure, it's having an impact not just on critical care, it's right through the system, right through to emergency departments. And that has implications not just for COVID patients, but for anyone seeking emergency care. We spent the morning at an A&E department here in Merthyr Tydfil at this hospital. It is coping, but as you'll see, only just.
Ward 3 have 18 COVID patients, Ward 7 have 23 COVID patients, Ward 10 have 23 COVID patients.
The day has barely dawned, and at the Prince Charles Hospital in Merthyr Tydfil, already the difficulties have surfaced.
105 at the time of the report and 2 deaths overnight.
Over 100 patients with confirmed COVID up on yesterday, and now more than double the numbers seen at the height of the first wave.
Well, I've worked here since 2004 as an A&E, from staff nurse up to sister, and this is the worst I've ever seen it. This is the most pressure we've ever been under, I think.
Morning, Jill.
Morning.
One by one, they're asked what bed space they've got, but it's not enough.
So we could be in a minus position of -6 beds for today's intake, is where we start the day off at.
Yeah.
And this is what happens when you have such a deficit of available beds. Patient after patient, on trolleys parked in the corridors of A&E, some very sick, all waiting for beds elsewhere in the hospital. Wilma Cooper, who's 90, had been here since 1 a.m. Have you been here in this trolley since you got in?
Yes.
Have you managed to get some sleep?
No. Be truthful about that.
You haven't had any sleep?
No.
How would you describe how busy it's been here since you've been admitted?
Crazy. Absolutely nuts.
As soon as we can find someone to examine you, we'll get you on the move and we'll get you sorted. All right, bear with us.
The patients on the corridors aren't suspected to have COVID. Those that are kept in cubicles to reduce the risk of transmission. In busy winter periods, patients do end up on trolleys in corridors here, but what staff say makes this time different is just how constant this pressure is and how regularly every single bit of corridor space is taken up by patients waiting on trolleys.
There's nothing. Every room we've got, all the cubicles are full, our recess is full, minors is full. We even have bed weights over in minors every single day where we cannot bring the bed weights over because A&E is full to bursting. Which means the queue of ambulances outside grows longer through the day. How does this compare with the first wave?
So it's definitely worse. We've got an extra 2 wards for COVID now compared to what we had in the first wave. The intensity is worse, the patients are sicker, we've had more people dying, and the staff are just worn out.
So from a staffing point of view today, we have 8 ITU nurses.
The amount of staff who are sick and self-isolating continues to add more pressure. All those red circles are where you're understaffed.
Yes.
I mean, that's quite significant.
Yes.
The burden on this workforce is all too evident. What's been the most difficult moment for you?
Coming in after 2 days off and realising you've lost the 4 CPAP patients that you've looked after the 2 days previously, which is what happened to me on New Year's Eve. I came in on New Year's Eve and I was like, wait, and they'd all sadly died. They'd all been intubated and it hadn't worked. We just lost so many patients, but we've also saved a lot of lives as well.
And with that, their emergency department prepares to admit another patient. Into a hospital where now more than half of all patients have confirmed or suspected COVID or are recovering from it. And on a day when the First Minister warned COVID rates across Wales are creeping up again.
Andy Davis there. Well, let's go to the Whittington Hospital in North London, which has seen one of the highest rises in admissions of patients with the virus in the country. Anya Pop is there for us. Anya.
Well, yes, today's record death figures are a grim reminder of just how grave the situation is. And just like that first wave, London is under huge pressure again because of the virus. So much so that today Sadiq Khan, the Mayor for London, declared a major incident. It's the first time he's done it during the pandemic, and that's because they believe that services here are at risk of being unable to provide a normal level of service. He said today that NHS in London is on course to become overwhelmed in the next few weeks, or in some cases in the next few days, and it's places like here at the Whittington that are at the sharp end of that. 2/3 of general and acute beds here are taken up by COVID-19 patients. That's the highest in the country. And when you couple that with general winter pressures and staff absences, and you begin to get a picture of just how under pressure they are here. On New Year's Eve, they ran out of intensive care beds here. But the pressure is across London. The London Ambulance Service, which usually on a bad day would field 5,500 calls, are currently getting 8,000 calls a day. And one way that they're dealing with that are joining up services. So the fire brigade helped in the beginning of the pandemic. They're still helping and they're driving ambulances. But now the Met Police are also helping. And that's one way that they're trying to free up paramedics to help.
And what can you tell us about how this compares to the rest of England?
Well, the rest of the England, 1 in 50 people are thought to now have the virus in the rest of England, and that's why they're concerned, because despite being in lockdown, the infection rates are still going up. Every region has more COVID patients than in the first wave of the pandemic. But in London, 1 in 30 people are thought to have the virus, and 1 in 20 in some cases. But there is a bit of light at the end of this dark day, and that is that a third vaccine has now been approved for use, the Moderna vaccine, so that will be rolled out later this year.
Anya, thanks very much. Well, Professor Hugh Montgomery is an intensive care doctor who is in intensive care unit in London right now. Professor Montgomery, describe for me the reality of that dramatic rise in figures across London. What does it actually mean on the wards, for the patients, for your staff?
It's much as you've heard described, really. It's extremely pressured. I'm glad that your correspondents have raised the issue that this isn't just intensive care. Every level of the hospitals across London are being very, very hard pushed. The acute medical wards are having to look after patients using equipment that would normally have been used on intensive care a year ago. So our wards are really being pushed very hard, the nursing staff very stretched, and the junior doctors. We've had to do what we did in the first waves, which is really all hands to the pump. So orthopaedic surgeons are helping turn patients. Our anaesthetic colleagues across London are helping out with pretty much everything across the hospital trusts. Our helpers have come back in. So all credit to them. People who aren't trained intensive care nurses but volunteered for us first time round. We've got a few of those back again to try to help out. But it's really, for most of us across London at the moment, I think it feels very much like we're just fighting fires all the time now. It's hard pushed.
Today we see the highest number of deaths recorded in any one day, the highest number of cases. Will this get worse for your hospital and others like it?
Well, I suspect that it has to for a while, because if it takes about 6 days to develop symptoms of COVID, for the majority of people who become gravely unwell, it's normally around 6 to 10 days after that. So we wouldn't expect to see the people hitting the wards and then the intensive care units for usually perhaps about 14 days after they contracted the disease. So the people that are hitting us now are those that contracted the disease between Christmas and New Year. If cases are still going up now, we can expect intensive care load to continue to rise for at least 10 to 14 days after that rise in cases. And that's pretty much inevitable. So yes, if they continue to go up as they are, we can continue to expect the pressures to increase over the next coming weeks. And therefore, I really can't appeal to the general public enough. Cycling into work this morning, the roads were heavily congested. They weren't like that in lockdown 1. I don't know where everyone's going, but an awful lot of cars on the road. And my juniors coming in this morning by tube say the undergrounds are pretty full. And I would just appeal to people. I know this lockdown is awful. I really, really understand it. And I also understand if you're poor and you have to try to get to work to earn. I do understand these things, but please, if there's any choice, please just stay away. You've heard that 1 in 30 people are carrying this. On an underground, you're going to pass at least 30 people, a lot more than that. High chance of contracting disease, high chance of passing it on. So please avoid other people if you possibly can. And wherever you are, it has to be the hands, face, space. It really does.
I mean, as a hospital, you sound incredibly stretched right now. Do you reach a critical moment when you can no longer take patients in?
That would be decisions for management. What we've been doing so far is, across London, is moving patients from the hospitals that are hardest pressed to hospitals who have a little more space. And that's worked very well. And my hat's off again to the transport teams who've been doing a most amazing job, actually. And to my colleagues around London who are taking patients in when they're already pushed themselves, but taking it from hospitals that are further pressed. My personal feeling is that there's almost infinite elasticity in the health service. None of us are going to be turning patients away that need our help.